In this video, we're going to start by looking at the bony landmarks of the skull. Now, if you're a first-time anatomy student, bony landmarks are probably not going to be your most favorite thing. They tend to be the structures that students struggle with the most because they have really long names and they're in Latin and Greek, which makes it a little bit difficult. Now, I'm going to give you a couple of tips before we start to point things out that should help you learn some of these terms. Tip number 1, break the names apart. What do we mean by that? Well, when I see a long term like external acoustic meatus, that's 3 different words I have to remember. What does each of those words tell me? External tells me it's on the outside. Acoustic means it has something to do with sound, and a meatus is a passageway. So I'm looking for a passageway on the outside of the skull that would let sound in. If you're thinking, well, that's probably where your ear is located, you're right, exactly correct. So remember, most terms are trying to tell you something unique about that structure. If you try to think about what the structures are doing, a lot of times the names will make sense. The second tip is to learn some of the common phrases that we use to describe bony landmarks. For example, the word foramen means hole. So any of the holes on the skull that we see are going to have the word foramen in them. A canal or meatus is a passageway. A process is something that sticks out of the bone. A spine is a sharp process, so it sticks out and it's very sharp looking. Okay, so keep those terms in mind. It will make your life so much easier. All right, so we're going to start by looking at the landmarks on our temporal bone. So if we turn this skull over on the side, we can start to name some of the structures. The first structure that we're going to name is this passageway on the outside of the skull. This is right about where the ear would be located. So this is going to allow sound waves to travel into the skull. Its name is the external acoustic meatus. External means it's on the outside of the skull. Acoustic means it's for sound. And a meatus is simply a passageway. Now, let's think about that term for a minute. We know that it's the external acoustic meatus, but what does external tell us? And you're like, well, Dr. P, you just said it's on the outside of the skull. Well, my question for you is, why not just call it the acoustic meatus? Well, the reason we call it the external acoustic meatus is because if we look inside of the skull, we can see another passageway right here. So there's a zoomed out view, there's a zoomed in view. These are our internal acoustic meatus. This allows our facial nerve and vestibulocochlear nerve to exit out of the inside of the skull. Now, the vestibulocochlear nerve, which I know is a long name, travels to 2 structures in the inner ear called the vestibule and the cochlea, which are used for balance and hearing, which is what that nerve does. So that's why this is the internal acoustic meatus. So internal acoustic meatus, external acoustic meatus. Now, to see our next structure, we're going to flip the skull over and look at the bottom and notice these 2 big bars of bone. If we follow those bars down, we get to these 2 little depressions. I'll hold it at an angle so you can see how my finger slides in there. A depression in anatomy is called a fossa or fossa. You can pronounce it either way. Now, these fossa are where our mandible attached to the skull. Now, see these kind of knob-like regions on the mandible? Notice how they fit directly into that depression. So we call these fossa or depressions the mandibular fossa because they're where the mandible attaches to the bone. Now, if we look at the bone from the side, right, we can see right here this very large projection. Now, you can actually feel this big bony projection if you take your fingers and you feel right behind your ear. You can feel that big lump of bone. When anatomists saw this, they thought that it looked like a breast. I know, it's not the most breast-like looking thing ever, but that's what they decided it looked like. So they used the Greek word mastos to describe it, which is where we get mastoid from. So this is the mastoid process. Mastos means breast, oid means shaped like. Again, sometimes you have to use your imagination. The mastoid process serves as an important site for muscle attachment. We have a big muscle in the neck that comes up and attaches here called the sternocleidomastoid muscle. If we go back to the bottom of the skull, the next features we can see are here and here. Now, notice when we look at these, how they kind of stick out. They're kind of like a little column or pillar shape. These are called the styloid processes. Stylos is a Greek word which means column. So styloid means column-shaped, process means it sticks out. So the styloid process is another muscle attachment site. Now, if we go from our styloid process, we go anterior, so we're going up here towards the face, and we go in a little bit, so we head a little bit medial, we can see these passageways here. Not this super big hole, we'll get to that one later. It's sitting right in front of the super big hole. These are the carotid canals. Carotid canals are what allow the internal carotid artery to travel through the skull and into the brain to supply oxygen. Carotid comes from a Greek word karoides, which means drowsy or sleepy. So your carotid arteries are your sleepy arteries. And that name makes sense if you think about it. If I pinch off your internal carotid artery, there's no blood flow to the brain, which means your brain doesn't get oxygen, which means you go to sleep, you pass out. So that's where we get the name carotid canal. It comes from the blood vessel that runs through it.